Welcome to Advocacy Denver's presentation on functional behavior assessments and behavior intervention plans. This presentation will provide you with a brief overview of what a functional behavior assessment is and how that assessment is used to create a behavior intervention plan to support a child and their unique behavioral needs. When talking about behaviors that a child shows, most schools decide to complete a functional behavior assessment to better understand how to support the student and the adults working with that child. Most behavior intervention plans, or BIPs, and functional behavior assessments, FBAs, happen together. The functional behavior assessment is developed to determine what is causing and reinforcing the behavior in question. Behavior intervention plans should be updated every year and also during the 3-year reevaluation. These should be also happening if a student has been removed from the school setting for 10 or more days. It is best practice to update the behavior intervention plans when a student is located to a different setting that is more restrictive, such as a behavior center or an out-of-district facility. Sometimes an FBA and a BIP can be completed to help the teacher work with a student. If a student is disrupting others' learning and if there are other behaviors that are more serious, such as violence and property destruction. A functional behavior assessment, or FBA, is an assessment that is used to better understand why an identified behavior is occurring, the purpose and function of that behavior. Behaviors do not occur out of the blue, but behaviors do happen because of a mix of things, including the environment, person, instruction, and motivation. A functional behavior assessment looks at all these things that may trigger, motivate, and improve behaviors. An FBA assists in looking at why the behavior is occurring and what is trying to be communicated. Behavior is a way of getting something or to get away from something. The FBA is an assessment used to provide some reasons around why that behavior is occurring. Behavior has a purpose. It is a way to communicate a need. Less desirable behaviors can be changed through learning new ways to interact. Behavior occurs everywhere and helps us learn how to survive. From young ages, we learn that how we behave allows us to get what we want or don't want. FBAs help us identify what exactly is being communicated through behavior and how to learn new replacement behaviors. Written parent consent is required for the school to conduct a functional behavior assessment. Typically, the school's mental health professional will conduct the assessment. They will utilize data from a variety of sources to determine the function or purpose the behavior is serving. Data collected will determine the antecedent to the behavior, or what is occurring right before that behavior happens, and what is the consequence of that behavior. This is called antecedent, behavior, and consequence, or ABC data. So what is the purpose of the FBA? The FBA provides a good guess as to why the child is behaving the way they are, and it allows for possible solutions to those behaviors, so the individual can then be taught different, appropriate ways to behave, so that they can be successful learners. Also, adult behaviors with children can be adjusted as well, so as to not trigger the students and accidentally reinforce that problematic behavior. Here are a couple of examples of how conducting a functional behavior assessment can assist in determining why the behavior in question is occurring. Once the function of the behavior is determined, a plan, or that behavior intervention plan, can be put into place to teach more appropriate behaviors that will serve the same function. Teaching replacement behaviors. The school team was able to develop a plan where both Charlie and Arlene received positive attention or praise for appropriate desired behaviors, rather than resorting to getting attention for behaviors that were less desired. Teachers were also able to be supported inside the classroom to ignore that inappropriate behaviors and guided through the behavior intervention plan with the specialist. A behavior intervention plan, or BIP, is created after the functional behavior assessment is complete. The BIP is specific to the individual student and focuses on the implementation of interventions that positively support the decrease of those inappropriate behaviors. The BIP is a living document that needs to be monitored regularly, consistently implemented with fidelity, and adjusted as needed. The behavior intervention plan supports those desired alternatives that allow the student to get the same needs met. They focus on those positive behavioral interventions, strategies, and support, and they make the current undesirable behavior less effective in meeting the student's needs. Key components of a behavior intervention plan include setting events that show the behavior that are most likely to occur. The plan includes what happens prior to the behavior occurring, which is called that antecedent, then the observed behavior, and what happens after the behavior or the consequences. This is that ABC data. The effectiveness of the BIP depends on identifying the strategies needed to reduce the behavior in question. What replacement pro-social behaviors need to be taught and reinforced with the student so they are still serving that function of that inappropriate behavior? A crisis intervention plan may be identified within that behavior intervention plan if the student may need some additional support within resources to maintain safety for themselves and others. Key personnel will be informed of the specific strategies and language to use with the student during the period of unsafe behaviors. Parents should definitely be a part of creating the BIP and that crisis intervention plan if needed. A behavior intervention plan is created after that functional behavior assessment, and it is very specific to the individual student and focuses on the implementation of interventions that positively support the decrease of those inappropriate behaviors. The BIP is a living document, and it needs to be monitored regularly, consistently implemented, and any adjustments need to be made throughout the year if needed. As the school is implementing the behavior intervention plan, data should be collected in a variety of situations and settings on how the plan is working. Are the interventions and support effective in reducing the inappropriate behavior? Has the student learned more appropriate replacement behaviors that are meeting that same function as the inappropriate behavior? Has the school team been offered training and support on how the family can implement that plan at home? These are questions that you can ask your student's school case manager. Some things that are included in a behavior intervention plan are the results of that functional behavior assessment, indicating what is the need that being attention or escape from those behaviors that are being exhibited. A list of specific behaviors such as on task, off task, aggression, blurting out, walking out of the classroom, biting, and much more. What are the potential triggers that will contribute to the negative behaviors? A specific plan of how more appropriate replacement behaviors are going to be taught and reinforced. How will this plan be communicated to parents and to all staff to ensure there is consistency in implementation among the adults supporting the individual? Who is supposed to be trained in that behavior intervention plan? And when do they come back together as a team to see if that behavior intervention plan is working based on the data gathered by the team? And as always, BIPs need to be updated as your child gets older or as the behavior intervention plan is no longer working for the student. Remember, you are the expert when it comes to your child. Strong communication and collaboration with the school team is important in meeting your child's unique educational needs. Schools value your input in the creation and implementation of support plans, and any questions you have are important to address as a team so your child has a successful educational experience. Thank you so much for participating in this webinar on functional behavior assessments and behavior intervention plans. If you would like additional information or would like to make a referral for support from Advocacy Denver, please feel free to contact us at the number above or fill out the online contact form.